Welcome, Carrie.
Thank you, Tara. I'm honored to be here.
Why don't you start out by telling us just a little bit about yourself?
Happy to. I am an attorney. I am currently the executive director for the Massachusetts Sheriff's Association. I am the chief jail advisor to the National Sheriff's Association, and I have been working in the field for decades.
You've been working very deeply in the MOUD and jail and correction space. Can you just walk us through a little bit about what's been going on in the last 5 years?
Absolutely. So, one of the things we know with the opioid crisis and hearing from the field to understand about opioid use disorder, the federal partners, BJA, NIC, working with NSA, and then in collaboration with the National Commission on Correctional Healthcare, released in 2018, October of 2018, the jail-based medication-assisted treatment promising practices, guidelines, and resources for the field. An extraordinary resource for all jails across the United States to learn more about opioid use disorder, the treatment for opioid use disorder, understanding what it is, how, if we were to set up some type of an MAT program, what that would look like, as well as including 5 centers of innovation, jails across the United States that had started in this space. And let's remember, opioid use disorder was just now seen as a crisis across the United States. Even communities were really learning about this and the medications and treatment for opioid use disorder. As our communities are learning about it, our jails, being part of those communities, are learning about it too. So it was really that resource coming from it from a jail-based perspective with our partners in the field who have the expertise to really help facilities, whether they were small, rural, large, understand everything around this space of opioid use disorder and the treatment for it in a jail-based setting. So that started in October of 2018. Following that, again, our federal partners, and I want to really emphasize this, everything that we do together is in this collaborative space. And what I applaud the federal partners for is hearing from the field, hearing this need to understand, and then helping to respond. As soon as the promising practices came out, and they really have received extraordinary praise for what they have contributed to the field. But now the next step was, how do we do this? There have been technical assistance provided. There are extraordinary grants and resources available, peer-to-peer learning. And one of the things, as I mentioned, that I really appreciate most are these 5 centers for innovation, where if individuals wanted to learn more, BJA, NIC have the ability for sheriff's offices to say, hey, I would like to travel. I would like to learn more. Can you help us to actually go and learn? And we saw that happening shortly thereafter and continuing to this date as other states are starting to implement and create an opioid use disorder medication assisted treatment MOUD plan for their facilities.
That's amazing. And then along the way, NSA passed a resolution in support of medication assisted treatment. Do you want to highlight that?
Yeah, and I'm very proud. And again, it speaks to the expansion. So one of the things I just want to highlight is this has truly been a paradigm shift in corrections. And we all have to recognize that, and we know things move slowly, but as we're understanding, we have a duty to protect. And part of that is understanding opioid use disorder and the treatment thereof, as now also our national associations also stepping into this space to really promote, to support, and to help sheriffs across the United States who oversee their jails to say that we recognize this crisis and we also want to help support this and help you to find that path to be able to provide it. So I want to talk about the evolution. In 2017, the National Sheriff's Association passed a resolution that at that time supported the use of non-narcotic evidence-based medication for the treatment of opioid use disorder. In 2019, we start to see an evolution the National Sheriff's Association passed a new resolution now to support all FDA-approved evidence-based medications for the treatment of opioid use disorder. And then in 2022, an even greater expansion, the National Sheriff's Association released a third resolution in this space, now recognizing not only all FDA-approved medications for the treatment of opioid use disorder, but recognizing this as MOUD, and also recognizing and including supporting as part of this resolution the treatment for pregnant people who are experiencing opioid use disorder, and recognizing that, as well as the treatment for withdrawal management for individuals who may not voluntarily wanting to participate. As we have seen the expansion and understanding about opioid use disorder, so have our national partners as well. Step by step, we start to understand that what started out with non-narcotic now recognize the expansion of all FDA-approved medications for pregnant people, for individuals too who are experiencing withdrawal, and together really working to promote not only the treatment for, but also to create and support outcomes for individuals returning back to their communities and ultimately saving lives.
I think it's so important that the association really spoke up and brought their voice into this conversation. That voice here, sheriffs hearing from other sheriffs in their association on this matter was so important. So I'm glad that you highlighted that. You mentioned the withdrawal guidelines that DOJ, BJ, and NIC, this was a joint effort on the part of those two federal agencies, released recently the withdrawal guidelines. Can you highlight why those were an important step to be released?
Absolutely. So again, we heard from the field, right? We heard from the field about trying to understand opioid use disorder. And again, now responding to the field, what we then started to hear were there are some gaps, right? It's not just about opioid use disorder. What about those who are experiencing substance use withdrawal from other than opioids, and or those who may not want to participate in medication or a medication-assisted treatment program? So again, hearing from the field, BJA, NIC coming together and putting together this group of experts, again, whether addiction specialists, jail administrators, and other subject matter experts, to work on what was an enormous project, 2.5 years of really coming together with state-of-the-art guidelines for the field to really, again, help to answer that question. What do we do with others who are experiencing withdrawal? How do we help them? How do we provide care and prevent preventable deaths from happening, and or any complications? What's available for the field? So this extraordinary document that has just been released is state of the art. And I am so proud of the work that was done on this. But one of the key things with the withdrawal guidelines, just like the promising practices guidelines, this is a community problem. It must be a community solution together. The guidelines are very detailed, recognizing we have small and rural and large facilities, but they can't be done in a vacuum. So these have to be shared with our medical providers in the facilities, as well as our community providers and hospitals. Together, we're all on the same page about treating substance use withdrawal in a correctional setting, and again, avoiding medical complications and ultimately preventing any type of deaths.
In addition to working at the national level, you obviously work deeply with the sheriffs throughout Massachusetts. As you look around Massachusetts, can you highlight some of the successes you are seeing as Massachusetts has adopted all forms of MAT?
Now, this may sound like a brag session, but I'm very proud of our sheriffs, and they are national leaders in this space. And back in 2018, a sheriff's-led initiative, and I think that's really important to hear. This was a sheriff's-led initiative to start with a pilot for the treatment of opioid use disorder with all forms of FDA-approved medications supported by the legislature. The legislation went into effect March 1 of 2019. There were 5 initial pilot sites, quickly expanded to 7. In Massachusetts, we have 13 sheriffs who house incarcerated individuals. 7 of those are part of the pilot. Now, let me just say as a caveat, that is not to say the others weren't providing it, but the initial 7 were part of this pilot, which we were watching nationally as well, to see how all of this would come together and what we could learn from them. And remembering, one of these facilities was actually one of the centers of innovation, that was Middlesex, in the Promising Practices Guidelines. I couldn't be prouder. And as of 2023, every sheriff in the Commonwealth, all 13 of our sheriffs are providing all FDA-approved medication-assisted treatment where, in fact, the medications are available in their community. For example, on Duke's Island, there is no methadone, therefore they wouldn't provide methadone, but rather if an individual was in need of methadone, they would transport them to one of the other facilities. But as we have seen the expansion, with all of the sheriffs providing the medications, we know, again, sheriff-led, sheriffs understanding this crisis and this need and responding to that.
Thank you for that exciting update, Carrie. And thank you so much for taking time to chat with me today.
Are you kidding? Again, it's an honor, Tara, and I'm excited to be part of this conversation. And most of all, if you have any questions, if anyone from the field has questions, please know BJA, NIC, extraordinary partners, and have the ability to connect you with peer-to-peer learning with other jails and other sheriffs across the United States to learn really how to help implement and or expand any of your current programs.